What is new this year, 2011, is that your plan will pay 50% of the cost of brand name prescription drugs and 7% of your generic prescription drug cost while you are in the donut hole. This is a change that came about as a result of the healthcare law. Moving to the right side, when your total out-of-pocket expenses for drugs on your plan's approved drug list reaches $4,550, you reach the catastrophic coverage benefit. From then until the end of the year, you pay roughly 5% of your drug costs under the catastrophic benefit. Just to clarify a bit, your out-of-pocket costs include your deductible, co-payments, and co-insurance, but this does not include your Part D premiums. The gap will gradually narrow until it disappears in 2020. However, even after the gap is gone, everyone on Part D will still have the same level of cost sharing, about 25%, from the time you meet your deductible until the time you reach catastrophic coverage. Catastrophic coverage remains in place even after the coverage gap goes away. Catastrophic coverage starts when your total out-of-pocket drug costs have climbed to $4,550 in 2011. After that point, you only have a 5% co-payment. You can use AARP's donut hole calculator to find out if or when you will hit the coverage gap, and you will also find recommendations for less expensive drugs. When you click on the donut hole calculator, you just enter your zip code and follow the steps. It's easy to use and points you to ways to save right now on your drug cost. There's one more change related to Medicare that you need to know about. It has to do with premiums for people with higher incomes. As in prior years, you pay a higher monthly premium for Medicare Part B if your income is above a certain level. The income level starts at $85,000 for a single person, or $170,000 a year for married couples filing joint tax returns. Starting this year in 2011, income-related premiums will also apply to those who have Part D prescription drug coverage. The income levels for Part D are the same as those just mentioned for Part B. Starting this year, 2011, you will no longer have to pay for Medicare-approved preventive care services. You will also be able to work with your doctor on a personalized prevention plan to keep you as healthy as possible. This means that health problems can be detected sooner and treated more quickly. These are just a few of the examples of the new free preventive benefits. They include a free annual wellness visit, screenings for diabetes and certain cancers. This includes mammograms, colonoscopies, and other preventive screenings. These new preventive services are in addition to the free Welcome to Medicare checkup available to every new person with Medicare during the first year of entering the Medicare program. The Secretary of Health and Human Services may also add other tests, screenings, or counseling as we move forward in the future. You will not have to pay co-payments or deductibles for these Medicare-approved preventive care services. Screenings currently available, such as Pap smears and prostate exams, will continue to be available. Call Medicare at 1-800-633-4227 or visit www.medicare.gov to see which of the Medicare-approved preventive care services are covered at no cost to you. If you are in a Medicare Advantage plan, check with your plan to see if you'll have co-payments or deductibles for any screenings or tests. Many of us are concerned about planning for our long-term care, not only for ourselves, but for our family as well. Let's talk about planning for long-term care. The new law creates a new insurance program called CLASS, which stands for Community Living Assistance Services and Supports. You may have heard it referred to as the CLASS Act. CLASS is a voluntary national insurance program to help you pay for some of your future long-term care services and supports. The CLASS program will pay you a lifetime cash benefit if you paid into the program for at least 5 years, worked at least 3 of the initial 5 years you are enrolled, have a qualifying disability, and meet other eligibility criteria. How does CLASS work? All working adults age 18 and older will be able to enroll in the CLASS program. If your employer participates in the CLASS program, you will be enrolled automatically in the insurance through a payroll deduction unless you choose not to participate. You still will be able to buy this insurance even if your employer doesn't participate, if you are self-employed or have more than one employer. The CLASS program will likely start in 2012 or 2013. Federal officials will provide additional details as the new insurance program is implemented. This includes premium cost and the amount of cash benefits. Starting this year, 2011, you will have easier access to more information on nursing homes to help you select a nursing home or monitor the care of a friend or a loved one. It will be easier to file complaints about the quality of care in a nursing home. Your state will be required to have a process in place to resolve complaints about nursing homes. The nursing home must notify you that your complaint has been received and how it has been resolved. Nursing homes in your state will have to meet new requirements if the facility closes. Residents and their families must be told of the closure far enough in advance so they can make other plans for relocation. If you are married to someone on Medicaid who is receiving care services at home, you will have the same protections for your income and other resources as do spouses of those on Medicaid who live in a nursing home. This provision starts in 2014. You will find more information on Medicare's Nursing Home Compare website at www.medicare.gov/NH-Compare. If you are a small business owner or know someone who is, you know that it can be a challenge to be able to offer health insurance to employees. Under the healthcare law, more choices will be available to small businesses. Some small businesses may also qualify for tax credits to offset part of the cost of insurance. Let's start with finding health insurance for employees. Small businesses that do not currently offer employee health insurance will have more options in the future. Starting in 2014, businesses with up to 100 workers may be able to buy insurance for their employees through the new health insurance exchanges. The exchanges will offer a range of health plans to choose from. All of the plans sold through the exchanges must include standard benefits such as medical, mental health, prescription drug, and rehabilitation services. What if you don't offer employee health insurance? Will you be required to offer it? That depends on the number of people who work for you. If you have fewer than 50 employees, there will be no penalties for not offering health insurance. But as of 2014, businesses with more than 50 employees may have to pay an annual penalty if they do not offer coverage. Here's some good news for some business owners. You may be able to get tax credits to offset part of the cost of offering health insurance to your employees. It's estimated that 2.8 to 4 million small businesses will be entitled for the credits. The tax credits are retroactive to January 1, 2010. To be eligible for a tax credit, you must have 25 or fewer employees whose average annual wage is under $50,000 a year, and you must pay for at least 50% of the cost of health care coverage for your employees. The amount of tax credit depends on how many employees you have and their average wage. You can find more details about the small business tax credits by visiting the IRS website, www.irs.gov. Another helpful website is www.smallbusinessmajority.org, where you can find a healthcare tax credit calculator and other useful information. There are two other benefits for small businesses that we want you to know about. The first has to do with cafeteria plans. Starting in this year, 2011, businesses with up to 100 employees can offer what are called simple cafeteria plans. These plans allow employees to save part of their paycheck in an account that they can use to pay for future medical expenses. This saves your employees money because they do not have to pay taxes on the money they contribute to this account. The other benefit is the opportunity to apply for a wellness grant. The purpose of these grants is to help small businesses set up workplace wellness programs. Again, starting this year, 2011, a total of $200 million in grants will be available over a 5-year period. The grants will be administered by the U.S. Department of Health and Human Services, HHS. As soon as information is available on how to apply, AARP will let you know. You are bound to have more questions as the healthcare law is implemented. AARP is working hard to provide you with updated information. So please visit www.aarp.org/getthefacts. Following are some resources that you can use to get more information. Feel free to pause the video if you need to write it down. To learn more about future webinars, visit www.aarp.org/health law webinars. Has the healthcare law helped you? If you have a story that you want to share, AARP is listening. We are collecting personal stories of people who have already benefited from the healthcare law. Personal stories illustrate how the law impacts our members and their loved ones. Your stories help us learn what is important to you so we can continue to serve you and your family. Stories also help get the word out to the media, legislators, and other AARP members about the importance of quality, affordable health care. Your story may inspire others. Share your story at www.capitalconnect.com/AARP-SYS. Thank you